What's up, fam? Happy Dental Health Week. It's Dr. Rick here with a bit of an anatomy lesson for you today. I'm going to give you some ideas about what the inside of your jaw joint looks like to help you with some of the jaw pain symptoms that a lot of my patients are coming in with recently. Let's go. So, this is just a model of all of the bony, hard bits that make up your lower jaw and the part of your skull that it fits into. Now, this joint is a very complicated capsule with a lot of moving parts. This is bone, it's called your condyle, and this is bone. It's called your articular eminence, it's a part of your skull. Now, nowhere in your body do you have bone touching bone. So the incredible design is that in between the two, we have a disc of cartilage with no nerves and no blood vessels in it, so it doesn't feel anything, and it's very difficult to traumatize. It's very tough and hard wearing, and it takes all the shock of your normal functioning with biting and chewing, all the things you do with your jaw. Now, here's the issue. At the front, it's attached to a muscle called your lateral pterygoid muscle, and at the back, it's held in place by a ligament. Now, the issue and why it's becoming such a problem nowadays is because, as I've been saying, everybody's holding so much tension in their bottom jaw. What that looks like is a big muscle over here called your masseter, which when it tightens in this direction, closes the jaw like this. Also, when it gets very tense, starts pulling on this muscle here called your lateral pterygoid. When this muscle starts getting really tight, this disc of cartilage starts slipping. And that's what we hear as a click in most cases for patients with some sort of dysfunction of their jaw joint. It's not too much of an issue initially. We call that click disc displacement with reduction, so it goes back into the normal place eventually. The issue is when this is chronic, so when it lasts for a long time, this muscle gets super tight, and this muscle starts getting super tight, and the disc, instead of living where it's supposed to between the two bones, it actually slips forward. And then you have that bone on bone, which is the whole point of this joint, what it's avoiding. You never want this bit sitting on that bit for any length of time, and what's worse, it sits on this ligament. That ligament has blood and nerves and will actually become painful over time. And if the disc stops going back into the right place, you have what's called disc displacement without reduction. And that's when it gets a little bit more serious. We have to be doing lots of different things and attacking it from different angles with relaxing your muscles and getting the stress management under control. It can even get to the stage where you need surgery called an arthroscopy, or arthrocentesis, where they go in and clean that area from all the scar tissue that develops from having this thing clicking forward and back and just not being in the right place. Take home messages, guys. Please try to control your stress management from the get-go. That will solve the issue that's causing all of these other problems. If you can't, see your dentist, especially if you're getting clicking in your jaw joints or tightness in your face, and they can set you up with a plan just to avoid the problems that come further down from this disease. Thank you so much for watching, guys. If you got something out of this video or if you enjoyed it, please share it with your friends. Otherwise, there's much more on our channel right here. There's another one there, and there's one more right there. Hopefully we'll see you soon. Keep smiling.